Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave.
Well, today our topic is going to be metabolic testing. Tell us about that.
Well, it is it's a new approach. It's a measurable that we've got in the clinic here, and we've got a couple great guys and team trained up. That's Michael and Brady to administer this measurable, because what we're talking about is a few months back we talked about the old flashlight and the flashlight battery and the mitochondria that make energy. They make ATP. Well, we're best served when we can measure this progress. So we have a lot of folks that come into the clinic and they're like, "Oh, doc, I'm tired. I feel 20 years older than my age. I've got brain fog. I'm just feeling out of sorts." And we do blood tests, and we start hyperbaric therapy, and we start ozone therapy in many cases. And 2 to 3 months later, folks come along and say, "Wow, okay, I've cleaned up my diet some. I'm eating less processed food or cutting that out, and I'm starting to have more energy." And we can always remeasure those blood tests, but do we have an actual measure for what's happening at that mitochondrial molecular level, that metabolic level? And now we do. And so this tool it's pretty incredible. It's a tool that's out of Greece, and it's about a 10-minute test. Anybody can get this done. All they have to do is call the clinic and schedule an appointment. You fast about 4 hours before coming in, but we get you all the details on it. But it's unmeasurable. So, for instance, if we have somebody that's got really, really high blood pressure, but we don't measure their blood pressure, how are we going to monitor whether or not that's improving or not? It's pretty difficult to do. So the same thing goes for metabolic health. You know, if we're doing the hyperbaric therapy, if we're doing ozone, we're doing some neurofeedback, all the different things, getting you on the right supplement support when needed, how are we measuring that change? Again, a lot of folks will come back in, and those clinical changes, they'll say, "Yeah, doc, I feel like the best I felt in years now." But it really would be nice to have this measure, and now we have it. So it's a once. Typically, we'd measure it once a year after we make some recommendations in the clinic for treatments to get your metabolism boosted. But if you think about the old breath test, if you've ever had a family member that's got asthma, they've got to do this thing called a lung spirometry, and it's kind of similar to that. Have you sit in the chair and relax, and we put a little gauge on your face, and it's measuring at rest initially how well you utilize oxygen, and it's called that resting metabolism. And so what we found, and this is a lot of work my friend Dr. Frank Schallenberger has figured out over the years, and he's got a great book called Bursting with Energy, where he really gets into this metabolic testing and how powerful it is. But there's all these different factors that you can measure with this tool that predict longevity. They predict how healthy you are. They predict your biologic age, for instance. So it might be, again, Dr. Meyer is 47 years old, and I had my testing done about 6 months ago, and I was about 2 to 3 years younger than my chronologic age. Now, my goal and the goal for everybody that comes in, I want your biologic age to be less than your actual age. That tells me that we're on the right path from your health. But one of the big things that we measure, and it's called the F factor, the C factor, the M factor. There's these different factors in there that are going to give us a pretty good indication of, number one, if you don't burn fat very well, that could be an indication that you are at risk for some chronic medical problems, diseases and such. So once you come in for a visit, again, you can do this resting metabolic test, and then there's an active metabolic test for those folks that want to go and hop on the Peloton bike and find out where their fat burn zone is, find the exact range where they're going to be burning the most calories. We can determine that as well as a part 2 of the test. And the really cool part, after this is all done, you get an hour consult with a specialist with this device. Of course, I can always follow up with you as well to go over a game plan. It goes over nutrition, and it gives you a path forward. So really, really amazing tool. We're pretty much making it a standard part of the process for folks that come into the clinic as an initial measure to say, okay, where are we at now, and where are we at 6 to 12 months from now after we've implemented all these changes. So again, getting back to the flashlight, how well does our body utilize oxygen, Dave? And as we get older, our body, the battery gets more dim, and we don't utilize oxygen as well. So what we're doing with all these changes, we're working to help the body get onto a path of healing and balance. We're working on improving the body's ability to oxygenate, to utilize oxygen. And this tool is an incredible tool to measure that battery, for instance.
So let me ask you this. So you tested a couple of years younger than your actual age. If somebody came in, tested, for example, at 47, they tested at a biological age of 53, it'd be like, oh boy, I got some work to do. Is that reversible?
Absolutely. It's a great question. It's a pretty fun process to see that number dip south or go less than your actual chronologic age. So that's where you see when we're boosting all the body's metabolic processes through these lifestyle changes, dietary changes, hyperbaric therapy, ozone therapy, whatever the approaches we may exercise, that can absolutely stoke that metabolic fire and get the system tuned up, and you can start to see that number go in the direction you want it to go in.
That's awesome. So this is another tool, so to speak, in the tool belt here, another opportunity to peel back the layers of the onion. And I've been following, as you know, various doctors, and boy, they are really, really active these days because there is a lot going on in the health community, especially with Robert Kennedy Jr. involved in the Health and Human Services now. One of the things that seems to be the primary driver of a lot of folks like you is they want to get to the root cause. Yes, pharmaceuticals can be a bridge, but they want to get to the root cause of what it's going to take to make people feel better. They don't want to just Band-Aid something forever. They actually want people to get better.
Absolutely. And when you start that walk, I always say it's like you didn't get here overnight. And so kind of our propensity in the Western way is to say, I want that quick fix. But, you know, if you're 55 and you've got some joint pain and you know, you don't have the physical stamina you used to have, brain's not working quite as fast, again, there's no one magic pill for that. It's switching on. It's a transitioning into, this is why we call it a wellness walk. It's a process that you learn about and you get better and better of understanding your environment and your walk over time. Because, you know, for instance, 3 to 4 years ago, before I started down this journey and I was practicing 100% traditional medicine and doing nothing but pharmaceuticals all the time, I didn't realize what kind of toxin-filled world we lived in with regard to potential for pesticide exposure, to heavy metal exposure, to fluoride in the water exposure, to microplastics, to mold exposure, I mean, to different infections that we may have come across. We had mono when we were a young child, and that kind of is still lingering around. All these things, I was always just waiting to, all right, let's fix that immediate wildfire, and then just wait for the next one to pop up. That's kind of how the traditional, in many cases, approach was for me. When you talk about making these changes, it's been a walk I've been on myself of how do I clean my own environment up in my own home? Am I using, plastic baggies to put my grilled chicken in, or am I putting it in glassware? And so you're not going to get there overnight. Molly Avery, our functional nutritionist here, she also kind of talks about it as base camps. And you work on a few things, and then you start to feel better, and then you go to the next base camp up the mountain, and you're at a new position, and then you're like, oh, okay, I'm feeling better now. I'm seeing things better. Now I can work on some of these new areas. It's a journey. The cool part, though, is that once you go down, if you're committed to it about 2 to 3 months, and with our guidance, you can start to see some dramatic shifts in your life and how you feel. And now, again, we can measure those things. We can measure those things not only with labs, but brain gauge and our metabolic testing. We can measure those things and show that to you. But how good does it feel when you are getting to the root cause and you're kind of trying to figure out, okay, well, oh, wow, I guess my mold level was really high, and that's why my brain fog is coming on. I got that mold exposure because I was out, out on my acreage working. How many farmers have been exposed to like moldy grain, for instance? I mean, and so I never used to test for that. Now that's one of the things I test for frequently. It can have a big impact on your lungs, your allergies, your breathing, your brain. And so peel back those layers and start to work on those different toxins and address them and treat them, then that whole body starts to take lift off. And then you go right back down to that molecular mitochondrial level again, where we talk about how well do you utilize oxygen? How well do you make ATP or energy? Because if you're doing that well and really well, then a lot of these diseases aren't coming on board. You're having better quality of life, less inflammation, feeling a lot better. So that's why our focus is so often on metabolism and inflammation, because you focus on oxygenation and the different approaches to improve it and clean up that lifestyle, then wow, real change can happen in people's lives. And those changes are so dramatic in some cases that people are starting to, get their loved ones back. And they also are like, wow, I didn't realize I was feeling as bad as I was, because I'm feeling so much better now and I want more of it. So it's absolutely inspiring to be on this path. And like you said, in the journey that with that conference that I was at down in Dallas recently, a lot of hungry, traditionally trained medical providers that are actively looking outside the box at more and more ways to try to get to the root cause and help the body heal. That's empowering to have a group of doctors like that getting together that are collaborating. If you're a patient and you're not well, now is an incredible time, because you're going to see things come forward here. It's my prediction in the coming years, and even right now, that are going to be incredibly surprising and incredibly helpful for helping folks get their bodies back into balance. And again, we always used to just say, oh, it's just aging, just live with it, take your Motrin and that's it. That's just accept it. Well, I don't think we have to accept it anymore. And a lot of my colleagues from around the country and the world that are going down this path, the same mindset, and the team here that we have at Okoboji Wellness Clinic, we're all in this mindset together of it's a wellness journey, and we're all in it together, and it's an exciting time.
All right, so real quick, because as usual, we're way past time, so we don't have any idea usually on Wednesdays what you're going to talk about. You generally tell me, and I pick up the topic from there. Pretty crazy. I read this morning a doctor I follow, Sunil Dhand, D-H-A-N-D. Do not underestimate how making your metabolic health the number one priority in your life can completely transform your life in only a few weeks. I have seen people go from tired, stressed, and overweight to energetic, calm, and shedding the pounds faster than they could have imagined.
Wow.
Right?
Yes. Good timing. Profound and very true.
Yeah. Okay. How do folks come see you?
Give us a call, 712-339-6024. I can do a discovery call with you, which is complimentary. And that discovery call, it's a 15-minute visit. It's basically a chance to make sure we're a good fit for you, that you're kind of open to some outside-the-box approaches, and a few minutes to just give me an idea of what you're hoping to see, to work with us on. And that's a great opportunity just to kind of get the ball rolling. You can call us again at 712-339-6024 to make an appointment. We have a great team here just off Highway 71 in Spirit Lake, 3305 Berquist Avenue. So we got Shauna, we got Carissa that are incredible. We have an amazing place, and I'm blessed to work here with all these amazing people because it's actually fun to come here. How about that? You get to come to work and have fun.
That's how it should be. All right, very good. Dr. Meyer, thank you so much. Always a pleasure. We'll chat with you next Wednesday.
All right. Sounds good. Be well. Take care, Dave.
Thank you very much. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online, too. OkobojiWellnessClinic.com.